South Africans still reeling from the tragic news of a young woman, Nelly Tembe, who allegedly leapt to her death from a Cape Town hotel on Sunday. The 22-year-old had been engaged to musician Kiernan Forbes, known as AKA. Now, it's believed Tembe battled with depression, and that incident bringing into sharp focus discussions around mental health. Yesterday, a social media campaign to destigmatize mental health issues gained some traction on Twitter. Let's bring you this next discussion with our guest, a clinical psychologist, Dr. Sina Shearer, who joins us via our video link this morning. Dr. Shearer, it's great to have you with us this morning to discuss what is such an important issue, not only in the backdrop of the weekend, but in the context of the pandemic as a whole. Perhaps let's begin with, is there still, in the wake of this campaign on Twitter to destigmatize mental health care issues, is there still a battle with doing just that?
I think there's largely still a battle in doing that, Michelle. Unfortunately, there are huge amounts of people that live in rural areas, and I think that some of them don't have access to Twitter.
Yeah.
We also have a huge youth component, a teenage component, and also needs to hear these messages around mental health and what mental health is about and what it is that they're going through. So whilst we who are living in cities have access to some of the conversations that are being held nationally, we need not to forget that there are some people who don't have access to the platforms that we do, and they too need to hear that. And that is part of the reason why I'm out of the province of Gauteng for a while, as I'm having workshops talking about mental health, starting off in the Eastern Cape.
Wow, I mean, that's incredibly important work. And perhaps just give us a sense, if you've been in the Eastern Cape for some time and you can now see what some of the gaps are in addressing issues, particularly of mental health. Let's begin in that province. What are you seeing?
It's a lack of understanding, Michelle. People hear this word stress, and I'm stressed, and they don't unpack it and they don't understand it. And largely it's due to lack of access. It's also due to lack of knowledge. I don't think that in the province that I'm in right now, which is the Eastern Cape province, I don't think that a lot has been done to not destigmatize, but to rather educate, to start at the ground level of educating people around matters of mental health and what mental health is all about. So I don't think that the groundwork has been done, and that is the problem that we're experiencing in this province currently.
And I suppose the argument would be from many communities, not only in our country but around the world, but perhaps let's focus on the most unequal country in the world, which is South Africa. People are battling with socio-economic problems, and so in many respects, issues surrounding mental health takes a backseat to putting food on the table.
You are so right about that. And there's no other place, there's no other province where we see that more, where that's more prevalent than where I am right now, which is in the Eastern Cape. It's more prevalent here than anywhere else. The disparities do not allow for people to be able to start off these conversations, and sometimes the platform is not conducive for them to do so. We also find that there's a large rural community here, and if you have some of the leaders speak out and not understand what mental health is, and they're supposed to lead the community, then of course we are doomed.
Yeah. So what is government's role? You're doing incredibly important work in the Eastern Cape. Where does government fit in terms of filling that gap in education around mental health?
Government has programs, and most of the programs that they've got are on paper and hardly reach the people that they're supposed to, or the community that they're supposed to reach. But they look good, they look great on paper. The implementation, I think, is the problem with them. And so private organizations and civil organizations such as us, we then step in and do what is necessary. We can't wait for any more people in our country to die as a result of suicide.
So let's talk about that, Dr. Shearer. Let's talk about how, if I'm listening to this interview right now, how do I know that I might need help? Perhaps a basic question, what's the difference between feeling depressed and depression?
Depression it is a constant, to summarize, it is a constant feeling of helplessness. So if this feeling of helplessness persists, one then has to seek help immediately. When I say persist, I say if it lasts for longer than a week and you are unable to pinpoint what is it that makes me feel so helpless and emotional all the time, then one needs to seek help immediately. The South African Depression and Anxiety Forum do have a helpline, which is toll-free, that one could contact. There are also organizations, several other organizations that one could contact to start talking to a therapist immediately and do not wait. So if you have an overwhelming feeling of helplessness and it's persisting and you are unable to pinpoint what it is, where it originates from, that my advice would then be to start counseling or seek counseling immediately.
And if I am someone who is a loved one who is concerned about perhaps the mental health of someone in my orbit, what are some of the telltale signs that I need to look for, and how do I go about addressing an issue like that?
The first point would then have to be to try and have an open conversation with the individual, raising your concerns and allowing for them to respond. Also then asking them if you are able to seek help on their behalf or that assist them. So first have a dialogue with them and then seek help in terms of having to refer them to somebody. Sometimes we don't listen to those who are closest to us and we jump to certain conclusions. So the first point would be to first get a point of understanding and then make a referral.
I mean, that's a difficult ask, isn't it? Because we've just talked about the stigma still associated with issues surrounding mental health. You know, that person might not be ready or able at that moment to talk.
When it is done with care and love and non-judgment, then it is likely that the individual suffering from depression is likely to open up. People suffering from depression have got a bust of emotions and a roller coaster of emotions that they are grappling with. And when you come and approach the individual and you are empathetic and wanting to hear and wanting to listen, it is likely that they will agree to wanting to seek help. But it must come from a place where you are loving, genuine, and gentle about it.
Yeah. Dr. Shearer, just as a note before, a very important note before we let you go, give us a sense of, you know, if I'm listening to this interview and I want to get help for myself or for a loved one, how do I go about doing that? Where do I go?
The South African Depression and Anxiety Group are toll-free, and you can get they have a WhatsApp line as well. So anybody who's watching the program right now can just on WhatsApp, South African Anxiety and Depression and Anxiety Group on WhatsApp. Also, another good point to start is a community police station. They normally have a social worker on site, or if they're not on site, then they're able to get them on call. I'm also available on socials, Dr. Sino Shearer, Dr. Sino _Shearer. You're able to get me on Facebook and on Instagram for free advice. And if you just send us a message through, our WhatsApp line is also online.
Dr. Shearer, thanks very much for that important information. He's a clinical psychologist as we continue to talk about the impact of mental health, and if indeed you or a loved one do need help, where to get that help. You can head on over to the South African Depression and Anxiety Group's website. It is SADAG, that's SADAG.org. You can also reach Dr. Sino Shearer on his Facebook and Instagram pages. Thanks very much indeed for your time.